Hey everyone, welcome back to Zen Zone Health. Today we're diving into a topic that's incredibly important for all of us: cardiovascular health. Specifically, we're going to be talking about heart attacks and 12 warning signs that might indicate an impending heart attack. Early detection can truly be a lifesaver. All right, let's jump right into the first warning sign: stomach pain. You see, pain from a heart attack can actually radiate to other parts of the body, including the stomach. Some people experiencing a heart attack might feel a tightness or burning sensation in their chest, but for others it might feel like indigestion or severe heartburn. So, if you're ever experiencing sudden, unexplained stomach pain, especially if it's severe or accompanied by other symptoms, don't just brush it off. It's always better to err on the side of caution and seek medical attention. Let's move on to another classic warning sign: pain or numbness in the left arm. When a heart attack occurs, it can disrupt blood flow to the heart muscle. This disruption can trigger pain that travels along the nerves, and because the nerves that run from the heart and the left arm share pathways, the pain can be felt in the arm. Sometimes it's more of a dull ache or a tingling sensation, and it's not always just the arm. Sometimes the pain or numbness can radiate down to the hand or even up to the jaw. Any unexplained pain or discomfort in your left arm, especially if it comes on suddenly, should never be ignored. Next up, we have lightheadedness. But when it comes to your heart, lightheadedness can be a sign of something more serious. When your heart isn't pumping blood effectively, your brain might not be getting enough oxygen-rich blood. This is especially concerning if the lightheadedness is accompanied by other symptoms like chest discomfort, shortness of breath, or nausea. Remember, our bodies are constantly communicating with us. If you're feeling lightheaded, especially in combination with other symptoms, listen to your body and seek medical attention. Let's talk about sweating now. We all sweat. It's a natural and essential bodily function. But did you know that sudden, unexplained sweating, especially when it's excessive, can actually be a warning sign of a heart attack? When your heart is struggling to pump blood effectively, your body goes into overdrive trying to compensate. This increased effort can lead to a surge in adrenaline, which in turn can trigger your sweat glands to go into overdrive. If you find yourself breaking out in a cold sweat for no apparent reason, especially if it's accompanied by other symptoms like chest pain, nausea, or shortness of breath, don't hesitate to call 911. Now, let's talk about a symptom that might surprise you: jaw pain. Jaw pain is actually a lesser-known but potentially serious symptom of a heart attack. The pain can originate in your chest and radiate up to your jaw, or you might feel pain solely in your jaw. If you're experiencing any kind of unexplained pain or discomfort in your jaw, especially if it's on the left side and accompanied by other symptoms like chest pain or shortness of breath, don't just assume it's a toothache. Let's talk about shortness of breath. This is a symptom that should never be ignored, especially if it comes on suddenly or is unusual for you. When your heart isn't pumping blood efficiently, it can cause fluid to build up in your lungs. This fluid buildup makes it harder for your lungs to expand fully, making it difficult to catch your breath. If you're experiencing shortness of breath, especially if it's accompanied by other symptoms like chest pain, sweating, or nausea, call 911 immediately. Now let's talk about fatigue. When your heart has to work harder to pump blood throughout your body, it can leave you feeling drained and fatigued. This is especially true for women who often experience fatigue as a primary symptom of a heart attack. If you're constantly feeling exhausted, even after a good night's sleep, and this fatigue is new or unusual for you, it's important to pay attention. Let's move on to leg pain. Intense leg pain, especially in the calves, can be a sign of peripheral artery disease or PAD. PAD is a condition where plaque builds up in the arteries that carry blood to your legs and feet. This build-up narrows the arteries, reducing blood flow and potentially leading to pain, numbness, or cramping in your legs, especially during physical activity. The same plaque buildup that causes PAD can also affect the arteries that supply blood to your heart, increasing your risk of a heart attack or stroke. Next up, we have swollen ankles. When your heart isn't pumping efficiently, it can cause fluid to build up in your body, especially in your lower extremities like your feet and ankles. This fluid buildup, known as edema, can make your ankles appear puffy or swollen. If you notice your ankles are frequently swollen, especially if the swelling is accompanied by other symptoms like shortness of breath, fatigue, or rapid weight gain, it's essential to consult with your doctor. Now let's talk about snoring. While often dismissed as a harmless annoyance, snoring, particularly loud snoring that's linked to sleep apnea, can actually put a strain on your heart. Sleep apnea is a condition where your breathing repeatedly stops and starts during sleep. These pauses in breathing can cause your blood oxygen levels to drop, forcing your heart to work harder to pump blood effectively. Let's talk about an irregular heartbeat. Sometimes you might feel your heart skip a beat, flutter rapidly, or pound in your chest. These sensations, known as heart palpitations, can be harmless, especially if they occur occasionally. However, if you experience frequent or persistent heart palpitations, especially if they're accompanied by other symptoms like chest pain, shortness of breath, or dizziness, it's crucial to seek medical attention. Finally, let's talk about coughing. A persistent cough, especially one that produces pink or white mucus, can be a sign of heart failure. Heart failure occurs when your heart can't pump blood effectively enough to meet your body's demands. This can cause fluid to back up into your lungs, leading to a persistent cough, particularly when you're lying down or exerting yourself. Thank you for joining me today on Zen Zone Health, as we explored these 12 potential warning signs of a heart attack. If you experience any of these symptoms, especially if they are severe or persistent, please seek immediate medical attention. Don't forget to share this video with your loved ones and help us spread awareness about heart health. Stay healthy, everyone, and take care.